Periodontics, it's a wonderful field because it's really close to medicine in many ways because we really focus on the overall health of the patient. And periodontal disease, actually, the most recent article in the last week showed that if you had periodontal disease, it increased your risk of dying from COVID-19 by 9 times.
Oh, that's recent, huh?
Which is amazing. Yeah, this is last week because periodontal disease, the bacteria get everywhere. They go from the mouth. It shows you, it goes throughout the body. So there's about 40 different diseases it affects. The most significant, of course, is heart disease. The most recent article showed it increased your risk of myocardial infarction by 4 times.
Wow.
It increases lung disease, pneumonia. That's why people are dying from COVID, periodontal disease, because they die from pneumonia and the bacteria get into the lungs. They also, even more interesting is that the bacteria that we see, the spirochetes, they have been found in the brain of 90% of Alzheimer's people. So they think that maybe if we treated periodontal disease, we could reduce the risk of Alzheimer's because the spirochetes are what killed Al Capone. There's a different spirochete. He had syphilis spirochete, Al Capone, but it got into his brain. Well, these get into the brain the same way, they cause Alzheimer's. So that's
how do they travel and get that far in the body?
They get into the bloodstream. You can see, actually, maybe in this diagram, I have another diagram handy. They get into the bloodstream because there's an ulceration of the pocket. When you have gum disease, the inside of the gum is actually ulcerated, just like you skinned your elbow. And if you have it all over, think about it, 360 degrees around 28 teeth. They figure the injury is as big around as the palm of your hand. So it's like having a big infection on your leg that's infected. It spreads throughout the body.
And like an open wound.
Open wound, yeah. It's an open wound, really.
And that's why they say even on the skin, you could have the smallest cut and the rate of pathogens getting in there is so quick. It can be so small.
So even when you eat, that ulcerated bacteria spreads throughout the body, all right?